A man writes, "Can you tell me how to find a woman's G-spot? How I can stimulate it?"
The G-spot is also referred to as the Grafenberg spot because it was named after German gynecologist Ernest Grafenberg. It's an erogenous area of the vagina that may lead to powerful orgasms and potential female ejaculation when it's stimulated. It's located 2 to 3 inches up the anterior wall and is sometimes considered part of the female prostate. Although the G-spot has been studied since the 1940s, there is still disagreement over whether or not it exists. Some people consider the G-spot to be an extension of the clitoris. For some women, stimulating the G-spot area creates a more intense orgasm than clitoral stimulation. Many women identified feeling it with intense pressure or manual stimulation rather than simply penetration. Attempting to stimulate the area through sexual penetration is difficult because of the particular angle of penetration required. But there are sex toys that were created just for G-spot stimulation. Typically, they come with a curved tip in an attempt to make the G-spot stimulation easier. Interestingly, women who experience vaginal orgasms are more likely to have thicker tissue in the anterior vaginal wall, and it's been theorized that the vaginal wall is in fact the clitoris. There was a gynecologist, Dr. O'Connell, who performed dissections of the female genitals of cadavers and was able to map out the structure of the nerves in the clitoris. She found far more erectile tissue associated with the clitoris than is described in the textbooks. She stated that the pea-sized nub where the inner labia meet is actually only the tip of the clitoris, and it divides into 2 roots, legs, and bulbs that can be about 4 inches long. So it's theorized that stimulating the vagina without activating the clitoris is difficult, if not impossible, and that the sensitivity of the lower anterior vaginal wall could be explained by the pressure and movement of the clitoris root during penetration. Female ejaculations, or squirting, as a result of the G-spot stimulation have been observed as way back as 1672. Even though the fluid is released from the bladder and some of the fluid is similar to urine, it contains non-urine ejaculate that originates from the Skene's gland. People are so fascinated with finding the G-spot that there's actually a procedure called G-spot augmentation, or G-shot, where collagen is injected directly into the G-spot, which is intended to temporarily increase pleasure by increasing the size and sensitivity of the area. However, the American College of Obstetricians and Gynecologists stated that there was no valid medical reason to perform the procedure, and it has not been proven safe or effective. But one of the reasons that women still undergo this procedure is because they feel sexually dysfunctional if they don't experience or find the magical G-spot. All women are different, and I don't like the term G-spot because it almost implies that there's one magic button for everyone. And I've actually listened to podcasts with Beverly Whipple, the woman who actually named the area the G-spot, and she said she wished she didn't use the word spot either. Nonetheless, if you or your partner are trying to find this area using fingers or a toy, you may want to stimulate the anterior wall of the vagina upward toward the belly button and kind of a come here motion. If you're adamant in trying to achieve this through penetration, there are some positions that are more successful than others. Cowgirl, where a partner is lying on their back and then one partner is lying on their back and then a partner climbs on top of them, allows you complete control over rhythm, depth, and angle of penetration. So you can focus on finding your G-spot area. Don't go up and down, try moving more back and forth. Doggy style also provides another good angle. During penetration, try leaning down on your forearms or pushing your hips backward to change the angle until you find that magic position that works best for you. There are also angled pillows. I call them cheese wedges. They allow for different positions while putting pressure on the front of your body, allowing the interior wall of the vagina to experience more pressure. The G-spot responds more to pressure than friction, so avoid the in and out.